My name is Claire Hardy. I'm a senior lecturer in the Centre for Organisational Health and Wellbeing in the Division of Health Research. And I'm also the admissions tutor for our blended learning PhD programme in Organisational Health and Wellbeing. There's currently 3 of us in the centre. We'll shortly be joined by a new professor in the next academic year, hopefully. And much of what has already been presented and discussed applies to our programme and the centre as well. So our course, like all the other PhD programmes, includes students completing a range of methodological training modules about conducting rigorous scientific research in health in the first 2 years of the programme, before then going on to the research phase where you carry out your own PhD research, which is an independent piece of research that we supervise. Our programme, we provide specialist knowledge about organisational health and wellbeing, which is a specific context of health and health research, the health of people at work. Very important, very impactful on individuals, organisations, but also wider society as well. So on our programme, we spend 1 module providing the foundations of this concept of organisational health and wellbeing, what it means, the different perspectives on the area, and we look at the underpinning theory and models of organisational health and wellbeing that examine the different factors that can have an influence or cause health or health and wellbeing in employees. We look at some of these factors in more detail, factors related to the individual, the employee, but also factors related to the working environment and the person's job as well. We spend time looking at workplace and workplace interventions for health and wellbeing, how we might go about creating one and evaluating one appropriately. And this is one of our particular areas of interest and expertise in our centre. So I mentioned that I currently work with 2 colleagues in the centre. So we have Dr. Sabir Giga, who is a senior lecturer in organisational health and wellbeing, who has a wide range of interests that you see on his profile on our webpage. But in particular, he's interested in topics around workplace bullying and psychological safety in the workplace. So that's what makes us feel able and comfortable to be able to talk openly about different things in our work. I also work with Dr. Abigail Morris, a lecturer in our team who is expert in workplace interventions around levels of physical activity and sedentary behaviour in employees. Again, Abby has other interests too that you can see her profile and on the information about our centre. And then myself, I have a range of interests in organisational health and wellbeing, but in particular, women's health at work and menopause is a big area that I'm interested in. I also do research on international working and psychological resiliency in employees. One occupational group I've been researching quite closely over the pandemic is how COVID-19 has impacted on oncologists and cancer care around the world. But this is just one of many occupations that I like to research, and our students carry out their research on a wide variety of occupational groups, wide variety of industries and countries. So we're quite experienced in accommodating students who have a wide range of interests in research. Now, our students typically, like most of the programs, they're usually working professionals, and our students tend to come from areas such as health and wellbeing, health and safety, work psychology, but they work in a variety of different places. So some work in public sector organisations, private sector organisations, some in large, some very small national or international organisations, and they come from around the globe. So we're quite a diverse group, which makes it really fun and really interesting to be a part of and learn from each other and the places where we work around the world. All of our centre staff, we carry out research and we work with teams and collaborators from across the world. We use a variety of different methods and approaches to our work. And then from that, we provide our expertise and advice to organisations, professional bodies, government groups at national and international levels. We also contribute to the development of workplace policies, guidances, again, national, UK level and at international levels too. So we're quite active in our engagement in applied practice and consultancy, as well as our academic research, because it's quite important for us that our work be translated and adopted into workplaces to ensure workplaces have the best evidence-based practices that we can. So that's something we're all actively involved in as well. And we like to share what we do with our students and show our work, of course, and also in the meetings that we have with our students as well. And we encourage our students to participate in sharing their own work through attending conferences, publications, and other avenues open to them as well. So we really like to see applications from those who have those kinds of ambitions for their own research and career direction as well. I guess the last thing I wanted to say, what we do in our centre is we try and balance the academic teaching and support that we give via the course with more informal support too. So we have additional group tutorial sessions where we all get together and we socialise and we talk about how we are. We try and foster quite a strong relationship with one another that we take throughout the year of the study on the programme. And this has been really helpful over the last few years with the pandemic. But we also invite our alumni to keep in touch with us. We invite them to join us for events that we have, such as when we host external speaker webinars, for example. And we do that because we want to build and maintain quite a strong network of academics and practitioners, so we create the best opportunities to really make a difference to organisational health and wellbeing across our different countries, using the best evidence that we can in our practice. So whether you're a student or a former student, we like to keep in touch and support each other if we can. So that's all I really wanted to say. Thank you for your time. I'm really happy to have any informal discussion with anybody who might be interested in the programme. Feel free to email me directly if you have any questions at all.